I cannot agree more with you, Greg, in terms of goal setting for these boys. And um, one important thing is it is a progressive disease. As much as you can preserve or even maintain the disease, it in itself is a realistic goal um, to have. Where does the PCP, the primary care provider for the patient, comes into play in the multidisciplinary care? How do you involve them in your discussions with when you care for these boys?
Yeah, that's a great question. And having an active and engaged primary care provider really is critical for these children and can make their lives so much better. I live in St. Louis. We have people that travel over 3 hours to see me, and I tend to follow boys about once every 6 months. Well, they have a lot going on in between, and these families already spend too much time involved in the medical care, especially with all that multidisciplinary care we just talked about. So having a well-informed primary care provider allows these families to locally be evaluated for when they get their routine illnesses or their coughs and colds. A boy in a wheelchair with weakness who just gets an upper respiratory infection needs to be seen and evaluated, because that could potentially be very serious for them. And having a pediatrician or a primary care provider who knows the family, who's familiar with the patient, and who can assess them right there that day locally and triage them, boy, that's worth its weight in gold for these families. So just that right there, I think, um, really is such a critical part of taking optimal care of these boys.